Thank you so much, Paul. We're joined now by Dr. Kristen England, an infectious disease specialist with the Cleveland Clinic. Good morning to you, Dr. England. Bottom line, what's the game-changing piece of information that could come from these FDA meetings that people watching right now at home need to know?
Well, good morning. And certainly, I think the biggest question on everybody's mind has been, when can I get the COVID booster and which one should I get? So I think this provides us with a lot of wonderful data from this new NIH study that certainly getting a booster can be helpful, but you may be able to get a different booster than your original vaccine was. So it gives us an opportunity to get more vaccines out to more and more people.
So how soon could Moderna and Johnson & Johnson boosters, I know they've been waiting on approval, how soon could they be available?
Well, as soon as the FDA gives approval and then the CDC gives recommendations at that point in time, the vaccine companies are undoubtedly ready and willing to go. So it can take a few days, maybe even up to a week for the boosters to be out in the pharmacies and ready to go.
Well, there's a new study out, Dr. England, that shows from the National Institutes of Health saying that people who receive the Johnson & Johnson shot may be actually better off getting a booster from Moderna or Pfizer versus the Johnson & Johnson booster. Why is that the case?
Well, I think we're looking at the benefits of the mRNA vaccine. So understand that the study was small, so it was less than 500 people, and it's not been peer reviewed yet, but it looks as if maybe getting a different version of the vaccine is going to be the most effective.
Is there a particular reason why? I mean, I'm really curious about this because it seems as though all these boosters should be made the same or, you know, be equal.
Well, they're really not when you look at both Pfizer and Moderna being the mRNA vaccine type. So it depends upon the baseline. The Johnson & Johnson was based off of an adenovirus, so an older technology. The newer technology seems to be potentially more effective.
That'll be interesting if Johnson & Johnson have to go back to the drawing board or this data causes people to actually stay away from that particular booster and go for another brand. The researcher is also finding that about 90,000 COVID deaths between June and September could have been prevented if those people had received their shot. So what will it take, do you think, for people to actually go out? I mean, we're all very busy, and sometimes you just have to stop the world in order to take care of your health. But is there a message that you could give to patients to prioritize this?
Well, I certainly don't want to see you in my intensive care unit. That's one of the key messages. You've got to think about yourself and you've got to think about your loved ones. You know, 90% of the patients that we're seeing in our hospital right now are unvaccinated. And of the 10% who have been fully vaccinated, they've got underlying medical illnesses that really put them at risk for not doing well if they get exposed to COVID. So at this point in time, I don't want to give the impression that Johnson & Johnson is not a great vaccine. We have 3 wonderful vaccines out there, and they're available at so many pharmacies. So whether we're talking about boosters or not, the most important thing is for everyone to get the initial vaccinations. So please take care of yourself and take care of your loved ones.
All right, Dr. England, good, sober, and wise words from you.